Hi, my name is Ellen Kim, and I'm a radiation oncologist at Brigham and Women's Hospital and a clinical informatics fellow at Mass General Brigham. I'm presenting today COVID Pass, a case study for clinical informatics. I think every informatics presentation begins with Charles Friedman's fundamental theorem of biomedical informatics from 2009. And this figure or the theorem can be read as a person working in partnership with an information resource is better than that same person unassisted. And the first corollary to this is that informatics is more about people than technology. So, what is clinical informatics? My favorite definition is the application of informatics, clinical knowledge, and technology to continuously improve healthcare systems, services, and outcomes. And to clarify, this includes applications of machine learning or AI as well, but is not limited to those tools. Clinical informatics, more literally, is also a subspecialty board under the American Board of Preventive Medicine or American Board of Pathology. And you are board eligible if you are certified in a American Board of Medical Specialties member board, which includes the American Board of Radiology, and completion of either the practice pathway, which closes in 2022, or completion of a 2-year ACGME accredited fellowship pathway. Here are some examples of clinical informatics in action that are familiar to us. First, even the humble pager, or electronic health record selection, implementation, and training of staff. Importantly, this year, telemedicine and imaging informatics, and modern radiation treatment planning and delivery. And finally, COVID Pass, which I'll be talking about today. So if you rewind to 1 year ago, the pandemic posed urgent problems, and informatics helped produce rapid solutions. In March 16th, the Massachusetts Department of Public Health issued an order that hospitals must screen all employees and visitors for symptoms of COVID-19. And within 1 week, our institution implemented COVID Pass systems at hospital and clinic entrances for employees. You can see a screenshot on the right, and the code is publicly available if your institution would like to adapt and implement a similar system, as many others have done in the past year. This system has been improved and extended. It's now used at 74 locations in the Mass General Brigham system. There's additional information panels for scheduling tests and vaccinations and monitoring of side effects. And it's accessible in 4 different languages and 6 different methods, including Epic and Kronos. I think COVID Pass is a great case study for clinical informatics because it's not just an app. It's more about leadership and managing people and using technology to improve health systems. It was about solving a public health mandate, changing how every single clinical and non-clinical employee entered the hospital and clinic premises every day, and communicating rapidly changing protocols to all employees, especially when different hospitals and clinics had slightly different precautions or a separate EHR or different employee IDs. It's also about asking questions like, does COVID Pass effectively screen employees, or is it just an expensive inconvenience for everyone? These elements also highlight how much clinical informatics relies on interdisciplinary collaboration and communication. COVID Pass is supported by an amazing team of people across the Mass General Brigham system. I'd like to thank Hojat, Adam, Mark, and Joe for helping me in my projects, which I did not have time to discuss today, but will hopefully be published soon. And thanks also to the organizers of ROECSG for giving me this opportunity, you for taking the time to listen, and I'm happy to take any questions. Thank you.